There is news on the anticoagulant front. First, the FDA has approved the oral anticoagulant drug Apixaban to prevent stroke and systemic embolism in patients with non-valvular atrial fibrillation. The approval follows similar decisions by regulators in Europe, Canada, and Japan, which also cleared the oral factor Xa inhibitor for this indication in recent weeks. Remember that the drug is contraindicated in patients with prosthetic heart valves, and that there is currently no antidote to reverse the drug's anticoagulant effect should severe bleeding occur. In the second news bit, in circulation is a report on the platelet inhibition and patient outcomes, or PLATO study. The researchers report on the effect of potent platelet inhibition following acute coronary syndromes on first and subsequent occurrences of any of the primary outcome events such as cardiovascular death, myocardial infarction, and stroke, as well as on other ischemic events as second events. PLATO patients received either Ticagrelor or clopidogrel. What happened? Well, Ticagrelor is the winner, with fewer initial and additional events compared to clopidogrel. Recurrent major non-cabbage bleeding events were infrequent and not different between the two therapies. So in summary, in PLATO, treatment with Ticagrelor compared with clopidogrel resulted in a reduction in total events, including first and subsequent recurrent cardiovascular events, when compared to clopidogrel. These types of analyses demonstrate an even greater absolute benefit of Ticagrelor over clopidogrel than we previously reported. Think about it when you're taking care of patients with acute coronary syndromes. I'm Peter Block, and this is a CardioSource Heart Minute.